everyone. Hello, 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 hello.
Hello.
Welcome to the Remedy. We have with us our one and only Sister Patty. Say
Hi,
hello, Patty.
everyone. Hope that you had a
Hey,
great week and happy Memorial Day. Well, Memorial Weekend, not there yet.
that's right. And today we have a two-part show reserved for you. The first part of the show, of course, as you know, we have the lovely Dr. Sheila Francois, who's visiting with us today here on The Remedy. She's going to talk to us a little bit about COVID-19 as we move forward into the new normal. We're going to discuss what is that going to look like, what is that going to look like, and what we should be doing to keep ourselves safe. And on the second part of the show, we will be dealing with another virus. And it's not COVID-19, but it's this virus called sin. The crew will be here about 12:30. So I just want to take a moment to
Well,
welcome
that I don't
you.
know. That I don't know about. I don't send. So
You'll
All
be
my
all
sins
right.
were erased. All my sins have been erased, so I'm
that's
clean.
it. That's it.
Hallelujah.
Thank
Praise
you.
the Lord. Praise the Lord. Well, family, as you know, COVID-19 is here. It's been here and it's doing what um, a pandemic supposed to be doing, unfortunately. Um, Nevertheless, I truly feel that as a community, we need to be mindful. Number one, that this virus is still out there, and number two, we need to stay educated so that we can not only protect ourselves but also protect those we love, protect our children, our spouses, to make sure that our environment is as safe as it should be. And so that's the reason why we are here today with Dr. Gina Francois. Let me tell you a little bit about this beautiful woman who's sitting on the other side of the camera. Dr. Francois was born in Jacmel, Haiti. So those of you who are familiar with Haiti, if someone tells you they're from Jacmel, then you already know. Okay, my wife is from Jacmel, so you know that's where all the beautiful people are from.
They
Uh,
well, I have to say, Jacques Bell and Jeremy do have the most beautiful people.
Yeah.
However, you know, I have to
uh-huh.
chime in. OCAP have the most intellectual people.
Well, I'm from
So,
Ocap too, so
so you,
there
you,
you
you
go.
you know where I'm going there, right? We are the most intellectual ones.
Anyway, moving right along. Dr. Francois is a registered nurse. She's a graduate from Stanford University, where she obtained her PhD in biomedical science. Wow. She
Oh,
also
that's
worked as
not
a
my
scientist.
big talk, big talk.
Uh, she
It's
also
not
worked
easy.
as a scientist for a pharmaceutical company, and she was part of the research team for breast cancer. Currently, she works as a medical director for a large insurance company in charge of international accounts, and she's also working as an ER covering physician. So she's a very, very busy woman. So, Dr. Francois, thank you so much for being part of the remedy today.
My
So
pleasure.
let's get right in this. Let's get started with the question that everybody wants to know. When is this COVID-19 gonna be over?
COVID-19 is not gonna be over anytime soon, and because of that, because it is such a brand new virus, we don't know much about COVID-19. A lot of research is being done on it, but being that it is so new, not that the COVID virus is new, but the strain on virus is new. Because
Mhm.
COVID-19 is been around for years, except they call it COVID-2. This COVID-19 is part of something called COVID-2. It comes in different size and shape. Currently, we are dealing with the L and S shape. The S shape is the one that gives you the worst problem. The L shape is the people that gets things such as like a feel like a cold, feverish, and they bounce out of it. The other one is the one that takes you to the hospital on a ventilator and so on, and possibly death. Because of those two strains, a lot of research is being done, but we have absolutely no idea when it's gonna be over. So it is up to us, really, the public at large, to protect yourselves. because the doctors cannot do it for you. You have to protect yourself against COVID-19, and don't count on others to assist you on that. It's up to you.
Yeah, I mean that is very important. As you were describing the two strengths, um, I have friends and I know people who were affected with the virus, and every time you talk to them, it's almost like they have different symptoms. So,
Mm-hmm.
what are some of the symptoms that people should be aware of to know whether or not what they have may be COVID-19? And Pat, maybe you can talk a little bit about that as well, because there are some people who has just a few of the symptoms, and they never thought that was attributed to COVID-19. So
Right.
Yeah, as mentioned, I know people, there's a gastro component to COVID-19 that I think a lot of people don't realize, because overall it is a respiratory virus, but there is a gastro component. There's a neurological component as well. People have seen their toes get, a toe get more enlarged, the finger looking white and just displaced. I had someone told me that they had some tingling, some dermatological aspect as well, skin rashes. So it has different variations. It depends on how it comes to your body, but it definitely has some weird variations that are not the typical that you hear. Eventually, sometimes it gets to your lungs. Some people, it never gets to their lungs, but they still have the various variations. If you don't know what it is, if you know yourself best, be your own patient advocate. So if you don't know what it is, if you don't know how you're feeling, if you feel like you're feeling weird, it's best to call your doctor and probably get it tested now that we have more tests.
yeah, Dr. Jana, can you help us again? I still want to talk about COVID-19 as if we are just learning about this, because once again, different people have different symptoms. So I may think, oh, I just have a little cold and I'm okay. Or I may just feel like I'm feeling very tired. Maybe it's because I'm spending too much time in bed or whatever. What are some of the symptoms that are very important for people to be aware of as a sign to know, okay, you need to get to the hospital. This is not a time for you to be sitting at home.
Well, there are differences between a cold and COVID-19, and people need to understand that. Some of the differences are because people, that's their main concern. How do I know if I just have a cold, or how do I know if I'm really in trouble with COVID-19? And there are different things that you can look for. Like a cold, a fever is rare with a cold. It is very rare for you to get a fever with a cold. It's very common to get one with COVID-19. Okay, number one is a fever. Number two is the headache. Headache is very rare with a cold. And with COVID-19, you will have a headache. You're gonna have a pounding headache. The kind of headaches that you feel like your head is about to explode, that you're gonna feel with COVID-19. General body pain. Yes, you can get that with a cold. But honey, with COVID-19, you're gonna feel like a truck is running over you. That's the kind of body aches that you're gonna get with COVID-19, which is very different from the cold. You're gonna be fatigued with a cold. You're gonna get a little weakness with a cold. But with COVID-19, you won't even be able to get out of bed to get you a cup of water. That's how fatigued that you're gonna be. So there's a world of difference in that. Extreme exhaustion that you're gonna feel. I mean, you can be like a 20-year-old who was running a marathon, and all of a sudden you cannot even go to the bathroom by yourself because you're so weak. With COVID-19, you're gonna need someone to help you out. Some of the telltale signs with COVID-19, a cough. There's a difference in the cough between a cold and COVID-19. Yes, you can get a cough with a cold. I've had colds in my life, and the cough can be horrible. But believe me, it's very different. When you see patients with COVID-19 and that cough, they cannot catch their breath between the hacking. The cough is non-stop. It's like you want to gag. And you know how when you cough, and then you stop for a second so you can catch your breath. COVID-19 is like non-stop coughing. It just keeps coming.
Is it a dry cough or is it a mucusy kind of
cough? It's a very dry cough.
Dry cough.
It's a very dry cough, and if you feel like you need fluid, but yet your lungs are getting opaque. Your lungs are filling up, but yet
Mhm.
your cough is dry. So it's literally working against you. It's like they're coming head to head against each other, because you don't want to keep drinking because your lungs are being inflated, but yet your cough is so dry you want to drink.
Yeah.
So
So what makes it so deadly? I mean, you mentioned it felt like not like a regular cough, but you I hear you saying that it kind of prevents you from breathing, which is to me, the moment you start going in that route, this is
Mhm.
dangerous. So at some point, you need to make a judgment call whether to go to the hospital or not. So when should someone either be tested or go to the hospital?
Well, one of the things is that, if you're not feeling well, if you have those symptoms, absolutely, like Patty said, call your doctor. You know your body, you know what's right, you know when you're having something weird happening to you. Nobody's gonna know that except you. you
Mhm.
know. But some of the telltale signs, you got a fever and a cough. Absolutely, I would call my doctor and say, hey, I have this fever, I have this cough, and also take a timeline as to when your symptoms started,
Mhm.
because they really want you to see there's a 14-day timeline on your symptoms. So when you start with a fever and a cough, jot it down as to when you notice that's been happening to you. Another thing is, if you live in an area with the virus or have traveled to places where it has spread, and all
Mhm.
of a sudden you're having those symptoms, you gotta say to yourself, "Uh-oh, something's not right with me. I gotta
Mhm.
do something about this." I know that places like New York, New Jersey, and Michigan, those places got battered with COVID-19. So let's say that if I lived in the middle of like Brooklyn, which is being absolutely ravaged by
Yeah.
this disease, if I live in Brooklyn and I'm having these symptoms, absolutely, it should raise something in my head, and for me to
Mhm.
say, you know what, let me get myself checked out. But just because you're having those symptoms don't mean that you have to run to the emergency room. Let me be clear about that. Because what's happening with COVID-19 is that if you don't have COVID-19 and you have those symptoms can be regular symptoms, just like anybody else got a fever. A fever, that doesn't mean that you have COVID-19. You could be septic a little bit, or you could have a small infection or something else other than COVID-19.
Mhm.
However, because of the season that we are in right now, because of COVID-19, we are more quick to make judgment to say, oh, it's COVID-19.
Exactly.
Um, but if you do have those symptoms, absolutely go find a testing center in your area. They're everywhere now. And if you don't know where to go testing, call your health department. They will absolutely tell you where to go to get tested. Many testing sites now doesn't even need a doctor's note for you to go. You just go with a license or something and get tested.
Now,
So those are the kind of things that you have to that you have to take care of. If you have those symptoms, the first thing you have to do is, put yourself in a different area in the house. Don't infect the rest of your family. It's not gonna do you any good.
yeah, I wanted to ask you. Again, I'm from Haiti. And so, with my people, when you sick, there's always some kind of tea and remedy and real masque tea or something that you can take to either boost your immune system or prevent you from catching it. During this pandemic, I can tell you how many instant messages that I
Yeah.
received from my parents, from other people,
Oh
this
yeah.
herb and that herb and this medicine or that medicine. What advice would you give to us, to people who are getting all of these supposedly things that can prevent you from catching it? Are there any problematic can I say, by doing so, let's say I start taking all these different herbs, and can I cause more damage to my immune system than if I were just to follow the guidelines of taking the precautions that are necessary?
I'm very concerned about people who takes all those remedies. And I know our homeland. My mother, my God, she had a tea for every disease known to man. And it's our culture, and that's just the way it is. It's not gonna change. It's inbred in us. However, you have to understand the things that our people, most and our Haitian relatives don't understand is that everything that you do in life, there are consequences to them.
Mhm.
Okay, you taking this tea. whatever it is that's out there, there's so many of them that's out there right now. What other medications are you taking? What are the contraindications? Contraindications mean that if I'm taking this T, which is A, I'm taking this medication, which is B, how are they affecting each other? You know, people are on blood pressure medications, they are on diabetic medications, heart disease medication, and yet they're taking all these T's. Okay, how is that affecting your other medications? Because
Right.
most of these T's have no research done on them. It's because somebody drank it and they felt better, and now everybody's taking it. And so I would be very careful on drinking anything that I'm not 100% sure of.
And I want to add to what Dr. G is saying. I've been in the pharmaceutical field doing research for over 20 years. And I know my family usually always says, oh my God, you're so, because you've been in the pharmaceutical, everything for you is about drug. You're not really about the herbal tea and stuff like that. It's not that I'm not about the herbal teas, and I take herbal tea myself, but it's because also we don't know, as Dr. G is saying, the contraindication. I've actually watched where someone had taken an herbal tea and their blood sugar went to 30 because they had also taken their insulin, and then it really counteracted. So you have to be extremely careful, because unfortunately, I do believe in herbal tea, but with the other stuff that you're putting in your body, you don't know what it might do. And I have to say, unfortunately, you guys know that, you know, my mother-in-law passed from this a few weeks back. And I've learned a lot, and I have a lot of people that I've been talking to, a lot of friends and things like that. You have to know when you're your own advocate. I'm hearing some stuff in the Black community that has me baffled as to, are you kidding me? I know there was at the beginning, there was this thing of don't go get the test because they put the stick all the way to your nose. I've taken the flu test before, and that is going all the way to your brain, and that can actually make you get the disease. That is not true. That is not true. So we have to, there are some things that are going around us, our Black people, that we should know that is not true.
Right.
Taking the test is not to mess with anything in your brain. And also you have to know, as Dr. G mentioned, when is enough enough? You're taking all these herbal stuff, you're not feeling better. Make your own judgment. Or even if you're taking doctor medicine and you're not feeling better. I know there's this stigma right now about going to the hospital. We are all scared to go to the hospital. I get it. I want to. I am scared to go to the hospital. However, if not the hospital, go to the urgent care. You should know how your body's feeling. And I've had an employee of mine told me, my husband saved me. I didn't realize, as Dr. G mentioned, she was sick. She could not eat. She's like, I didn't realize how sick I was. Apparently, I was deteriorating. My husband took me to the hospital, and guess what? I had silent pneumonia. So she was not coughing.
Yeah.
She just could not eat. But she had COVID and she had silent pneumonia, and she went in the hospital for 8 days. And she said, my husband saved my life by taking me to the hospital.
That's absolutely possible. You can be sick and not be aware. I mean, there are many people right now who have COVID-19 and don't even know that they have it. And they're spreading it. Not because they're doing so consciously, but unconsciously, they're spreading it. You know, because COVID-19, there's not a sign on your forehead that says, I have COVID-19. You have it and you're feeling fine. You know, you're walking around, and the harsh part of COVID-19 is that today you could be fine. I'm working, I'm cleaning my house, I'm driving, I'm this, I'm that. And the next day, I can't even get out of bed. And that's how it hits you. It doesn't, in many people, it doesn't come like little by little. It's like a sudden feeling of deafness in you, you know, and many people end up going to the ER and then die within days simply because it just invades their lungs so fast. It doesn't care who you are, what you are, your skin color, your age, your whatever. It just wants to eat up your lungs, and that's what it does.
So we have a few questions from some of the listeners or those who are watching it on Facebook or on YouTube. The first question, I guess, for you, Dr. G, is this: So the question is there a COVID shot to help cure you like they have for the flu? I think that person is tired of it. You know, they just want to know,
Absolutely,
The
is
flu
there a
does
shot?
not
absolutely not.
cure the flu shot does not cure you by, as a matter of fact. But go ahead, Dr.
Exactly.
G.
No. The answer is a fat, ugly no.
Okay.
There is no there is no cure for COVID-19. There's no medication for COVID-19. There is nothing for COVID-19. What we are doing as treatments is trials and tribulations, as I call it. Okay? I will try medication on you to see if it works. If it works, hey, hoopla, we happy it works. And it may work on one person and don't work on the other.
Exactly.
So therefore, that's what they call it trials medication. There is no cure for COVID-19. The possible cure for COVID-19 is social distancing. Stay home. Don't be out there running around, going to Ross because Ross have a sale going on for $2. No, stay home. That's what it is. Stay
Dr.
home.
G, there's another question for you. Are there tests available for the public right now? Or are they still testing people who have trait similarity?
There are tests available. However, they want people who actually have symptoms to go get tested. If you do not have any, like me, I have not gotten tested, and I'm in the emergency room simply because, and I have it available to me if I want to, but I have nothing going on with me. I have had no symptoms or nothing. But if I had a cough or any slight or anything, I would have gotten tested. Although I might get tested because I want to see if I have antibodies in me. Because if I have the antibodies, I can assist someone else by donating blood. So that's a whole different story on that.
Okay.
But I might get tested next week because there's so much need for antibodies.
Yes.
So I may get tested. If I have it, I can donate and save someone's life.
And to go into the antibody, Dr. G, I was actually talking to my employee that had it, and she was scared because they call her, of course, for the antibody, and she was scared because she said a 2-hour practice. And I was talking to my physicians at work because, again, I'm in the pharmaceutical field, and actually I have one of my studies that is COVID study that we're doing. So I had to explain to her, listen, the antibody is a good thing. It's not going to hurt you. They take your blood because they need the plasma, and then they replenish your blood. I said, what you don't understand is that is actually going to save someone, because they do give that to someone that is hospitalized, that's really in need. And unfortunately, because we haven't had a whole lot of as much as they want for everyone right now, the only people that can get it is if you really, really bad. So I do encourage people to understand the difference. And if you can find out if you have it, it is a very, very good thing to go and trying to, get that plasma taken out so it can eventually help someone.
We have another question. I'm sorry.
One second. They are really in need of the plasma. Let me put it out there. Simply because if you've had the disease, if you've been exposed to COVID-19, or if you've had it, you're being hospitalized, and you think, and by the grace of God, you go home after being in the hospital, that absolutely you have the antibodies. Those antibodies, the plasma that they took from it, believe me, can save life. In fact, that's the best medication right now for COVID-19.
That is
that plasma that's taken from people who have been through COVID, giving to somebody who's going through it right now.
Yeah. So there's an education that we need to do, because she was definitely afraid, and I was like, no, we really need that. Like if like just it can save so many lives. Like you really need to do that.
Absolutely, and don't be afraid. It's just like blood. It's just like donating blood. There's nothing.
And it's about 2 hours of your time.
It's about 2 hours. It's a needle prick, and then you sit there, and they take it, and just think about. You can save many lives just by doing that. So please, if you've had COVID-19, call the Red Cross or any centers that's nearby you. Tell them that I've had it and I want to donate some of my antibodies turn into plasma. Please do so.
But they call you, because they called her and say, hey, we know, because she was in the hospital. They said, we know you had it. We know you recovered. Could you give us some plasma?
Yeah, it's very important.
Yeah. Since we're talking about testing, there is a question on testing here. This is coming from Woody. She said, what are your thoughts on the rapid tests available on the market right now?
What I can tell you is, don't be going to some, backdoor place and get tested for COVID-19. There's a ton of those tests that's being thrown around from China, from wherever they're coming from. I would not step foot near any of those places. Go to a center of your town, of your city that have steps taken, that have lines, people waiting to get tested on those centers. That's where you need to go. Do not go to your girlfriend's house who happen to buy on Amazon and you're doing a swab test somewhere. Don't put yourself through that, because the disease is too deadly for you to be playing around with it. It's too deadly. Literally your life depends on that test. So absolutely, go to a center. They are everywhere now. My hometown have two. Every day there's lots of people waiting to get tested. It is worth waiting online to get tested. Don't get impatient. So, if the line is too long, whatever. That's just the way it is. That's just what we're living through today, and you have got to adapt.
Yeah, and for those of you who are watching and who resides in Philadelphia, you can go to 500 South Broad Street at the health center there to get tested. Dr. Francois, this person says I'm compromised. Is there any other precautions people like me should be taking?
If you are immunocompromised, you are part of what we've called the high risk group. The high risk are people like that who have some kind of disease that makes them immunocompromised. People who are over 65, people who have diabetes, heart failure, all of those chronic diseases, kidney disease, liver disease. Absolutely, you are high risk, and you must take extra precaution not to get COVID-19. Now, I don't want people to think that if you get it and you have the disease, you will die. I'm not saying that. What I'm saying is that you might get it worse than the next person because you are exposed. Your immune system is weaker than the next person. Therefore, once it is weaker, the infection have free roaming. Like it's gonna come, it's gonna take over because you're weak. It's like two people fighting. Let's say that two people are on the ring fighting, boxing. The weaker one is gonna fall. That's just the way it is with people who have all those kind of diseases. COVID is gonna come in. COVID is gonna say, "Oh, okay, I see that immune system is kind of weak over there. Let me go right to it." It's gonna go to that to your immune and knock it out.
And so this is one of the issue that I think the reason why I think this kind of show is important, because now that people are going back, the quarantine is being lifted, and so you're gonna have different type of people mingling with one another. People are going back to what they consider their what normalcy used to look like. So how do we protect ourselves? I mean, I can only speak for me. When I go out, I come back, I make sure I wash my hands or put away the clothes that I had on and things like that. But we are part of a family. When you are part of a family, you have wife, husband, and children, and we're all going out and we're all doing whatever. How do we protect ourselves individually, and what can we do to protect ourselves as a family, as a unit, so that we are watching out for one another, living under the same roof?
Let me tell you, and it's funny, I was talking with someone about this the other day about what do you do? I tell people, you have got to look at the virus as an event that's coming to you. One of us, there are three of us on that screen right now. I promise you, in about 6 months, one of us is going to have COVID-19. It is almost guaranteed.
It is.
Or if you don't have it, somebody close to you will be affected.
It is.
One or the other. Okay? So you have got to prepare. I tell people, COVID-19 is just like, I live in Florida. It's just like, that there's going to be a hurricane coming.
Yeah.
So if I know there's a hurricane coming, what do? I prepare myself for the hurricane. I go out, I buy food, I do this, I do that, whatever I need to do for the hurricane. You have got to look at COVID-19 as such, because you or someone you love is going to come down with it. How is it going to affect that person? God only knows. It might be mild, it might be extremely strong, just like a hurricane. It might be 1 or it might be 5.
So then in that case, can you run through it with us? What are some of the things that you should be doing as we are preparing? Let's say someone in the house is affected. What step one, step two, step three, and so forth? What are the things we should
Okay.
be doing?
One of the things that you should be doing is you have got to meet as a household or larger family to talk about who needs what. Don't wait for that moment to come for everybody to start going crazy to figure out what we need to do for that person who has COVID-19. Meet up with your family members and have a plan. If you have people in your house that is at a higher risk, ask their doctor what to do should they start having those symptoms. Okay, that because your doctor should be your partner in your health status.
Mm-hmm.
All right, talk to your neighbors about emergency planning. One thing that I do, and most of my colleagues do, I join a neighborhood chat group to see what's happening in my neighborhood, who has COVID-19, and whose house you should stay away from. I'm part of that neighborhood chat group. Find communities and organizations that can help with healthcare, food delivery, or anything else that you might need in your house should you come down with COVID-19. Make an emergency contact list. Include your family, friends, neighbors, your doctors, your pastors, whoever that you want to be, whoever you want to know.
As your support system. Mm-hmm.
You know what I'm saying? An important thing that you have to do, choose a room where you can keep someone who's sick or who's been exposed separate from the rest of you. You must look at your home and say, okay, if one of us have COVID-19, where are they which part of the house are we gonna close out and have that person in there? Because you have got to separate that person from you. Like in my house, I have an in-law suite. So I know that I can close that door and have that person in there, and I can bring their food, open up the door, put their food in there, and they can eat it. They should not be around you at all. Now let me be careful with this. Just because you're putting someone separate from your house, don't mean that you're isolating them. Call them on the phone while they're in there because they're gonna go crazy, sit in that room by themselves for 14 days. Do FaceTime with them. Just because they are in a different room, don't mean that they are not part of your family. They're still there. Don't forget about them. Okay? Because being by yourself can play tricks on your mind, and loneliness is very harsh.
Mm-hmm.
And talk to your child. Those of you with children, talk to your child's school about keeping up with assignments. One of the things that I actually was doing a radio show 2 weeks ago, I was talking about Haitian parents who have children at home, but they don't speak English. So how are you helping your children if you can speak English? Doing assignment. Many Haitian parents don't know how to use computers. How are you doing that? So that is something that's part of our community that we must also talk about. But that's a whole different segment.
Mm-hmm. Mm-hmm.
Reach out. One thing that I want to tell people: reach out to friends or family who live alone.
Yes.
Please do so. Reach out to those people who live alone, because I'm telling you, I used to be a travel nurse when I was working as a nurse. And I traveled all over the US as a travel nurse. Let me tell you, people think it's such a glamorous thing, but I was extremely lonely. When you get into a hotel by yourself in a city, you don't know where you are. You have no family or friends. You by yourself. Loneliness plays tricks on you. Okay. You become depressed, and really, depression is a whole different state of mind. So reach out to those folks, and tell them that you're there. If you have an elderly person that who don't drive, go shopping for them. Don't leave them alone. They're gonna die alone. So if you care about somebody, reach out. But the most important thing that you can do for yourself is social distancing. People, stay home. We have no cure for COVID-19. And there's no cure coming. I don't care what anybody says. If something pops up tomorrow, the question that you gotta ask yourself is it safe for me to take? Absolutely. They're gonna say, oh, we got a cure, and when it comes online for vaccinations, okay. What's gonna happen to me 1 year from now after I take that shot? Because we don't know. Patty knows about clinical trials. It takes time for you to know what's happening to your body after one shot.
Yeah.
How is it working against my medications? How is it gonna work on my liver? How is it gonna get through my system? Is it to my kidneys or my liver? If you have diabetes, your kidneys are compromised in most diabetic patients. If that vaccine works through your kidneys, believe me, you don't want to be there for that.
Agree.
because your kidneys are very much needed for you to survive.
Mhm.
So that
And
medication interacts in your kidneys, you have a problem.
And as Dr. G said, you don't know. I don't take the flu shot. I remember my oldest two kids. I used to have them take the flu shot, and 1 year, I guess I don't know if it was a different strain. Both of them, 15, 16, they
Mhm.
got so sick that the
Right.
doctor I had to take them to an allergist. They had to give them prednisone for 2 months. And
Mhm.
never again did I give them the flu shot. So you never
Yeah.
know when you
You
put
don't
in
know.
this thing in your body what it's gonna do, because it's your body receiving that thing. It's like an immunotherapy. I take immunotherapy shots for my allergies, and every time I go, I have to sit there for 20 minutes because my body can have a reaction. But even when I
Absolutely.
leave the office, it takes 24 hours, and I had
Mhm.
reaction at the office when I
Mhm.
had to take EpiPen. So it's the same as the flu shot. You never know how your body gonna react.
Mhm.
Mhm.
We have another question here on the line. It says that is COVID-19 airborne? And they say with certain states opening back up and people going back to work. Again, here's the question again. What precaution do you recommend? This is what everybody's asking. This is what people wants to know. Like, what should they be doing now that they're going back to the regular routine again? But
Well,
is
let me put
COVID-19 airborne?
Yeah, is it
well,
air?
no, it's not.
Okay.
It's not. But let me just say this: there is no such thing as going back to regular routine. Whoever said that is wrong. We will not be going back to regular routine for years to come. Okay. It is not airborne. You have to inhale it. It's a droplet. People think it's airborne. Let me tell you why people think it's airborne. If I'm standing here and I cough, I go. The droplet is very light. It can go up in the air because it's a droplet. And then you come where I was standing and coughing. You had no idea that I just coughed. When I cough, this thing can stay in the air for however, because it's a droplet. It's very light. The air can travel it. If there's a wind, the wind can travel it. Okay? And you come in where I was sitting there, where I was, and you inhale it. That's it. You inhaled the infection. But as
So,
far as airborne, no, it's not airborne, meaning in the sense of airborne that people think of. You say
Which is great
you
for
have to
us, because
inhale
I
it.
think if it was airborne, many of us would not be here. So it's actually
We
a
would
good
all be
news.
dead if that thing was
Yes.
airborne.
but you see, but I'm listening to you explaining this, and I have pictures in my mind right now because, you step outside right now. Not everyone, people do what they want. Some people do wear masks, some people don't wear masks, and so for you to step outside your house, you definitely have to make sure you're wearing a mask. From what I'm hearing from you, and we also have to be careful wearing a mask because sometimes we wear the mask, but we put it right under our chin.
Yes.
And we only put it on when we are talking to someone. But here you mentioned that someone can cough and you're just going for a walk and you're
Mhm.
walking right into the environment where the cough was with your
Yeah.
mask right underneath your chin. It's no good to you. So it's again, it's being mindful 100% of the time of your surrounding and remembering
Right.
that there's a virus out there that's killing people.
I was
And that's
go ahead, Dr. G.
and that's the problem. People tend to forget. They when they go out there, they think, and let me tell you, it's human nature. Because we want to go back to the way things were. Absolutely. So do I. Who doesn't wants to be out there? I used to go running, and I haven't ran since this thing started. Because I'm afraid to go outside running.
But you know what the
But
difference is, Dr. You know what the difference is, Dr. G, is that being in the health field, you see it.
oh
So
yeah.
guess what? Even though you still want to do what you're accustomed to,
Mm-hmm.
you are in the health field. You see it. You know what can
Mm-hmm.
happen. A lot of us, unfortunately, are seeing it through TV.
Mhm.
I
Yeah.
know someone, so it's real to me, and I know a lot of different people that have had it and lost people. But if you got remote from it, guess what? Specifically around here in the East Coast, where the weather's getting nicer and people wants to go out, you just think just because they're reopening things, that means the virus load has gone down, when that's not necessarily true. So it's kind of like out of
Yeah.
sight, out of mind. Nobody's watching CNN as much anymore, which is good because for mental health, you kind of need that. But because most of us are not impacted in a day-to-day life as you and or the frontliners, sometimes people tend to forget and start relaxing what they need to do to save themselves.
I know, and it's sad because I've seen people with mask on. They put the mask like round underneath their chin, and it's like a necklace. I'm like, okay. The other day, I had to go to the store to pick up some meat for dinner, and I'm walking, and I saw these two guys sitting. There's a bench, and they all sitting there, they're having a good time talking, drinking a beer with no mask on. So I approached them. I'm crazy like that. I approached them. I said, do you guys need a mask? Because I have some in my car. And people are afraid to approach people like that because they think that they're gonna be cursed at or whatever. I don't care. I'm a healthcare provider. I've seen what COVID-19 can do. If you're gonna curse me out because I'm trying to help, so be it. But I'm gonna do what I feel like I need to do. And they said to me, we work for construction business. We don't make much money. We can't go to the stores buy. And that's what people don't seem to understand. Sometimes people just can't afford stuff. So I went back to my car. I always have masks in my car just for this purpose. If I'm out, I see people without masks, I'll offer it. Do you have one? And I went to my car. I got 4 masks out of my car. I gave 2 to each guy. They were so thankful. So that's why sometimes I say to people, don't prejudge because you don't know what someone is going through.
Correct.
Don't prejudge. You must wear your mask, people. You got it. That's really your only barrier between you and somebody with COVID-19. And people are talking. I saw on Facebook or somewhere on the news. Some people are walking around saying that don't put your mask on because then you're gonna inhale your own CO2, which is a carbon monoxide. That's not true. That is absolutely not true. Your only barrier between you and somebody with COVID-19 is that mask. Put it on above your nose, not under your nose.
Yes.
Under your nose, you're gonna inhale it through your nose. Please, over your nose. If you have glasses, put your glasses on when you go into the stores. If you're gonna go out, because it has been known that you may catch it through the eyes. Put your glasses on. Put your mask on. Gloves. You have to be careful with gloves because you can do cross-contamination. If you wear gloves, you have to know when to take that thing out of your hand and not touch other surface because then you can contaminate other surface. But at least what you should do when you're going out is put a mask on above your nose and put a pair of glasses on. I don't care if it's your regular glasses like I have on or sunglasses, something to block your eyes. That's it.
And if you have the surgical mask above your nose, you press it down. There's a little thing that you need to press it so it doesn't get into your nostrils because that's what you want to preserve. What I usually do is I'll put the surgical mask on around here and I'll put my glasses on top of it. So
over it.
Area, so that way you don't have anything. You're not inhaling anything. Now, Dr. G, what do you think about the heat itself? People are saying, and I know that also we've seen it in the East Coast where during the cold season, you definitely have more flu than you would during the hot season. So I know that they're saying the same for COVID-19. You in Florida, do you think that the cold really play a factor as it relates to a virus like COVID-19?
I don't really think so. Because if that's the case, the rates in Florida wouldn't be so high. Okay. The rates in the islands wouldn't be so high. I mean, Haiti's getting hit right now. Haiti's like 100 degrees every day. I have my daughter is married to a Jamaican guy. They were in Jamaica. Jamaica is getting hit every day. And it's like hot like crazy in those places. So why do they have COVID? I mean, sometimes you have to think about it. What do the islands who are like 100 degrees having COVID-19, if that's the case? I think that the point that I want people to understand is that we don't know.
You don't.
Unfortunately, we have fear of the unknown, and that's a regular thing. There's nothing worse than not knowing what's going to happen tomorrow. There's nothing worse than that, and that's what we're going through right now. We don't know. Let me tell you, we don't know nothing about COVID-19. We don't know its treatment. We don't know how long it's gonna last. We don't know who's gonna get it worse than the other. Now it's hitting children. At first, it was thought that kids don't get it, but now I have teenagers right now in the hospital. Right now I'm taking care of a 15-year-old with COVID-19. She's doing better. The first thing that she noticed was a rash. She wasn't coughing. She had no fever. She had nothing. She had a rash. And her mother was putting, the stuff all over her skin. It's a regular rash. And then 2 days later, she couldn't breathe. And she came to the emergency room. And I swabbed her. Sent it down to the lab for a step result. Came back positive.
Yeah.
And we started giving her remdesivir. But remdesivir is not a cure. For
Correct. Correct.
Not a cure.
So,
And that's another thing that it's a good thing that you brought that up, because once, I've worked with remdesivir, and people are like, oh my God, it is not a cure. And it's only something that you can get in a hospital. And even with that, people still die. And it's a shortage. If your body likes it, it's just short. And yes, being in a hospital 4 days less is better, because you have the infection-based hospitalized that you get. I get it, but that doesn't mean everybody that is when remdesivir actually live. It's not a cure. It's something that we have that might help.
Yeah, remdesivir was created to treat Ebola.
Yeah.
That's what it was for Africa when the Ebola hit. That's what it was created for. But it seems to help someone to lessen the stay in the hospital, and that's wonderful. It works on some people, it doesn't work on other people. So you don't know who is going to work on. We don't know.
Correct. Dr. Francois, I want to go back a little bit to something you mentioned earlier. We were discussing the proper way of wearing the mask. How valuable is a mask? I think that's the number one question. Number two, when should you get rid of your mask? Because right now people are ordering masks, and they have those Haitian masks. They have beautiful looking masks that you can wear with your clothes. I mean, how
what the heck
it's a whole new lifestyle. Hey, it's all great and all, but when should you either dispose them, or when should you wash them if they are washable? And how should you dispose your gloves for people who wear gloves?
Well, your mask should not be worn continuously. And I tell you why. People don't seem to understand that. I put my mask on. I go to Walmart. Somebody next to me coughs. And whatever he or she coughs is right here on my mask, on the outer part of my mask. So first of all, if you have a mask and you wear it outside, do not bring it into your house.
Do not bring it to your house.
Do not bring it into your house.
Okay.
Because you're carrying the germs from outside.
Exactly. Do not bring your mask inside your house. If you have a garage or something, leave them out there. Do not bring them inside your home.
Now I've been hooking my mask in my car. That's a bad place to leave it as well.
The best way to leave it is in your car. I tell people to leave it on your dashboard. Let it hit the sun. Leave it on the dashboard.
So should you reuse the mask? Because I try not to reuse my mask. Do you reuse your mask? No.
But people have those expensive masks that they buy.
Yes.
If that's what it is. But if it's a cheap mask, if it's a surgical mask, you throw that thing away after you use it. You do not reuse masks, because masks have bacteria in them. Okay? You wear a mask, you go to Walmart for whatever you want to do. Somebody coughs on you. The outer part is no longer clean. That outer part of your mask. So imagine you go home, you take that mask and you plop it right on your countertop or whatever. You are spreading the virus around your body. Leave that mask alone. Leave it, throw it in the garbage if it's a surgical mask, because surgical masks are one-time use. However, if you buy those expensive, whatever, mask that you wear, I would leave it in the car and I would wash it after you use it. And when I said wash it, I would at least use a little Clorox on it if you're gonna wash it. That's what I do, because I don't want to tell people to throw away the expensive masks. But if you do that, wash it with a little Clorox product to take away the
So,
bacteria.
so then we can assume the same thing. The same thing goes with your outfit as well. I mean, we wear garments to go outside, but when we come back home, should we strip all of those things and put those away to be washed instead of walking around the house with the same thing that we went to Walmart with?
Let me tell you what I have in my house. In my garage, I have a bin for dirty clothes. Nobody who goes outside come into my house with their clothes. Nobody, including me. I don't care if it's a one-time wear. Yes, my water bill went a little bit higher because I wash more. That's not worth my life. Okay? You come into my house because number one, nobody comes to the front door. Everybody comes to the garage door. You strip down or leaving only your underwear, and you put those clothes in that bin for wash. My clothes are one-time wear since COVID-19 started.
And what
And that's
about
just
hair for the ladies with hair and things
right.
like that?
Yeah. For the hair, it hasn't really been proven that you can catch it from your hair, but there's been speculations about it. People are even saying, but in the hospital, if you can go to the hospital, I would absolutely put a cap on my hair. I would when I go to work in the emergency room. First of all, I don't go with this wig. I go with a shorter wig, and I put a thing over my head because it has been kind of speculating that it is attaches to the hair that you're wearing. Okay, and so do not come inside the house with whatever you've been wearing for the day, because you don't know who was next to you. You have no idea. And don't judge somebody simply because somebody looks great. You don't think they have COVID-19. That's not true. It's just like HIV when HIV just came out.
That's
With
true.
HIV, we had no idea they were sick by looking at them. Until they got full-blown AIDS. You have to think about it the same way. You don't know who have COVID-19, so protect yourself against everybody that's out there.
Yeah, someone was just asking, since we're talking about the mask, do you recommend using a cloth mask or washable mask over the surgical mask? Um, I know some people just have the cloth mask to begin with, but if you were to have a cloth mask, do you need actually the question is, do you need to wear both?
No, not really. But if you want to go right ahead, because you must understand, masks restrain your breathing. So you're gonna have all these layers of stuff over your face. You're gonna have a hard time breathing.
Really, yeah.
If you got a surgical mask, you're good to go. Just make sure, like Patty says, push down on that thing here, that little crevices here, so that nothing gets into your nostrils. And that's what you have to do. But the people with the cloth mask, I have cloth masks also. In my house, somebody sent some to me, which I appreciate. I sent some to, I gave some of those masks to crisis center, where I have some women living there who don't have any money, whatever. So I donate those masks. But the cloth masks are okay. I mean, they are actually better than not having masks at all. I mean, I've seen people outside, I'm not kidding you, who put a t-shirt over their nose and they tie it as a form of, because if you don't have the money to purchase them, it's better than nothing. Even a rag, if you got a rag or a scarf, you put over your nose to protect. It is better than nothing, and they work. The only problem with the cloth mask is do not bring them into your home, and people do that. People go out and they don't wash them. They keep reusing them because it's cloth.
Yeah,
You
yeah.
know,
I mean,
but
I'm
in our
guilty. I'm
it's not
guilty
right.
of that. I have done that, and I
Yeah,
realized, wait a minute, what am I doing? I'm bringing everything back
Everything
inside
back.
the
inside your
house.
house. Exactly. You cannot do that. If you do that, tant que maman te dit longtemps, c'est laver bien sûr à terre. You can. That's worthless. If you bring your mask inside your house, it's like you are killing your own family.
Now, I have another question. Many of us enjoy going to the gym to lift weights or exercise and why not. Those things are about to be open as well. And churches, there was a question here from Woody. Um, the question was, how do you feel about the president mandating for church to open this weekend? First of all, I don't like the word mandate. Government should not mandate when church should be open or closed to begin with. Now, in the light of COVID-19, we still have to remember now those churches, the doors have been closed for over 2-3 months now. So the air quality inside of those buildings, I can only imagine what's happening right now. So if you're going to open your church this weekend, I don't know who I'm speaking to, from one pastor to the next, make sure you hire some professionals to come and spray the entire church to make sure that it's clean, number one. And you may need to have a mask for every single person who's coming to worship on that day and maintain the proper social distancing. That's from one pastor to another. I'm not a medical expert. That's what I have Dr. Francois here. So Dr. Francois, for those people who want to go back to the to church, I have friends of mine, brothers who wants to go back to the gym. Is that a good place to be? With the air being circulating the way, at the gym, you see what happened with the air. If someone cough on the east side, that cough can get to you on the west side, if you understand what I mean. What do you have to say about that?
Well, whenever I hear someone saying that I want the churches to open, or I want the gyms to open, or I want the hair salon, nail salon, whatever, wherever those places are to open, I say good for you. Okay? Good for you. However, what is it worth to you? I understand they have to open because they have to make money, they have kids to feed, they have bills to pay, whatever the decision may be.
Mm-hmm.
Good for them to open to make money. But is that worth your life? As far as churches are concerned, let me tell you, I was born as 13. My entire family are pastors.
Yeah.
Okay, I have three or four pastors in my family. Will I go to a church? No, simply because the church is so closed down, and I know many people are not going to spend the money to hire a professional cleaning to come in and clean because they're expensive. They're not cheap, especially these days. They hack up their prices because they know they're needed. So many, I know, I'm sorry for my Haitian people. I know that many Haitian churches are not going to hire those high price places to come in and do a deep cleaning, which is what's needed. Even after the cleaning is done, are you going to be able to maintain social distancing in the church? Mm-hmm. Most churches have 100 people with 4 little lines to sit. Why are they going to see that? How are you going to maintain social distancing in that church? I do online service every Sunday. I listen to service. I stay at home with my family. We pray together. We sing together. We worship together. That's what's going to happen for me until at least the end of the year. But for those who want to go to church, I'm not going to tell you not to go. Your friendship or relationship with your pastor or God is up to you. Mm-hmm. But I always tell people, yes, we should go to church and pray, but God gives you a brain to use. Okay, God's not gonna punish you because you don't go to a church. A church is nothing but four walls. The church is you. It is within you. Mm-hmm. Okay, so you decide as to what you want to do. But me, I would say no. I'm not going to a church. I'm not going anywhere where there's a crowd.
I was watching yesterday. I was watching CNN and I saw this whole comment about the church thing, which I really couldn't believe.
Oh, I know.
And there was a pastor an Afro-American pastor from Alabama, and he said something that really caught my attention. He said, people forget also that churches, a lot of churches have a lot of 65 and up crowd. Mm-hmm. So for you to say, specifically, this is such a vulnerable population outside of the social distancing. And then now, that is an area that is a place where a lot of 65 and up go. And he said, for him right now, he's not comfortable with that. And I wasn't even thinking about that. It really, really brought that to my attention. And then on the gym situation, I know Dr. G's going to talk about that. I had a telehealth with my allergist yesterday. He was checking up on me. And I asked him, I said, well, what are you seeing? What are what are some of the things? He said, with the hospital that he is affiliated with, he did see that the numbers went down. I said, well, what are some of the averages? And he said, it used to average about 239 a day. Now it's about 26 a day of hospitalized cases. That's in New Jersey. And I said, well, what do you attribute that to? And he said, well, definitely social distancing. And then he said everybody wearing a mask and potentially the temperature changing for us in this area. So then I said, well, how do you feel? I said, I'm an avid gym goer. I've been doing my gym at my house, but how do you feel about when the time comes for people to go to the gym? And he said, I don't think that's a good idea. I don't think specifically somebody like you should be going to the gym.
No,
That was his response.
I would not step foot in a gym.
That's what he
Gym is a haven for bacteria.
Yep. Because you
Yeah.
have the
Okay.
sweat. You have it's a haven for bacteria before COVID. So could you
Before
imagine?
COVID. Yeah.
It's a haven for bacteria. Why would you go to somewhere where people are heavy breathing?
Exactly.
They're running, the sweat is flying, and why would you want to put yourself in such a situation?
Agreed.
So, I would say no, but to each his own. If you feel that, getting that six-pack is more important than believe me, that six-pack is just nothing if you're dead.
That's true.
Okay? So, why would you want to put yourself, if you, get something put in a garage and start running. What I had to do, I literally went online and I got a second-hand, those things that you run. What the hell you call those things?
Treadmill. Yeah.
Mm-hmm. Second-hand, I paid like $80 for it. But it's worth it, and it works well. You know what I'm saying? And when I got it, I sanitized it because I don't know where it's been. I left it outside for 2 days. I sanitized it, and then I used it, and that's my exercise.
Mm-hmm.
The gyms are open because they need money to survive,
Agreed.
and they're depending on you to come in. Once you have COVID-19, the gym doesn't care. They don't care about you.
And that's the balance that we need. That's the balance we need to realize. This is a country that is based on business. So that's the balance that as a person you need to say to yourself, because it is a country that is based on business. Money makes us run things. So you need to, and health and business have never been something that go hand in hand. You have to make a choice. So that's where it comes to you and your family making the best choice that is best for you. Because as you mentioned, Pastor D, things are opening around us. Are you going to say, okay, because things are opening, then everything must be ready? And I think this is the part where we need to ask ourselves, is everything ready just because we all said that things are opening around us?
Yeah.
Let me tell you, I do two things. I go food shopping once a week. I don't go twice a week. I make a list to make sure that I have everything I need for that week. Make sure that you make a list, because sometimes we go to the market not knowing what the heck we want, and we're walking around like chicken with our head cut off. Make a list before you go to food shopping. I go there, I put my stuff, I get everything I need for that week once a week, and that's it. And I do not go anywhere besides going food shopping, or if I'm going to work. I'm not out there in parties. I don't do nothing extra, and so should everybody else.
Yeah, so we have someone just wrote, so work, market, home, is this life now?
It is.
It is.
It's a resounding yes.
Yeah.
But just to be on a positive note, I've spoken to some of my cousins in Haiti, and they have the internet, but unfortunately we don't have the internet like us. And I know we are tired. I know some people are homeschooling. I had to finish my semester online or whatever. I always trying to think of. I always tell myself, I guess I was raised with, it could always be worse. So I always put that in my mind, and it's like, to be honest with you, in America, it's not so bad for us, guys. It's not so bad. Yes, it could be better, and we've known better. Mm-hmm. But if that better means let's stay the way we are so that we can, like that, I think Pastor T.D. Jake said it in the thing that you sent to me, Pastor D. Mm-hmm. If that better means for us to be locked up for another year to get to 30, 40, 50 years, then it's not as bad.
Yeah. So
not as bad. And I guess that's the key. We have to look at this for the long run. We are so accustomed to, and the now, we want it and we want it now. We want to do this now. We want to go out now. We want to, and now this COVID-19, one thing that I've learned is that your now don't matter anymore. What matters the most is, do you care about the value of your life? Do you care
Yeah.
about the value of your family's life? I can tell
Mm-hmm.
you how hard it was for me to visit my parents. I went to buy groceries for them, and I bought the grocery to them, and I was standing out the door looking at my mom. I can tell she wanted me to hug her.
Yeah, no.
But
Of course.
I didn't want to hug her because I know I just came from a supermarket. I don't know
Mm-hmm.
what's for me. The same thing too. My daughter came by the other day. We went through that. She came in. There was no hugging. None of those things happened.
Yeah.
So this is the new normal,
There's the new normal.
and it's weird almost. But if this is what we have to do so that you can live for another 30, 40, 50 years, then you know what? It's a small price to pay. And I think that's the key.
Absolutely.
It's a small price to
Absolutely.
pay. It is, and Dr. Gina mentioned it earlier, it is our responsibility not only to look at to protect ourselves, but also to protect our families, to protect our neighborhoods. We all have a part to play,
Mm-hmm.
because if I don't care about the value of my life and I just act as if there's nothing going on out there, and then I picked it up and I bring it home, I may not have COVID-19 because my immune system, it didn't, but I may carry it to my house
Agreed.
and give it to my spouse or give it to my children. So that's the key. That's what we always have to remember, that we are all a potential carrier, and that means you can bring it home. So
Mm-hmm.
as we close today, Dr. Francois, if we were your patients, what would you say to us as we come to visit you at your, well, not visit you online. I mean, not visit you in the hospital, but if we were to have a visit with you, as we were leaving, what would you say to us as we leave, as we leave your office? And there is one more question. What do you say to those who can no longer earn an income? Wow, that is a loaded question.
Who could no longer earn what? I didn't hear that.
Who
And
cannot
income.
earn an income? Here's what I'm thinking, and I'm not an expert in earning income either. Okay, um, we are part of a community. We have to look out for each other. If you know someone who's struggling and you can provide that family
Yeah.
with a meal for the day, then do
Yeah.
that. If you can provide them with that $50 for the week, you do that. If each of us look at this and say, you know what, this is an opportunity for me to help someone, we have to do it. We have to be on the lookout for one another. There's enough of
That's
us
it.
to feed each other. I mean,
And
I
I
don't have
think,
to
and I
have.
think, Pastor D, I think Dr. G, you and I were talking about it the other day, and that's a loaded question. And I feel like sometimes, people are like, well, I've been fortunate. I've been working from home for 5 years. For me, this is not new. And my pharmaceutical world, we work globally, so working from home has not been, and I've been very fortunate. But then when you look at the disproportionate issue with Black people, it's because unfortunately you have a lot of us that even when they said everything was shut down, could not be shut down,
Yeah,
because
Mm-hmm.
we are the one most of the time that have the lower end jobs, and we had to be in the streets. And then unfortunately 70% of us are dying. I get the financial situation. I get it. I'm blessed enough that I don't have to be part of that, but I totally get it. However,
Yeah.
from one person that lost one person, I know that one loss was way too much.
Mm-hmm.
It was way too much. The pain that I felt and still feel is way too much. So yes, the money will continue to be an issue. But I agree that maybe that's when we need to support each other, because we are dying at a higher rate. When
yeah,
it takes
yeah,
us down, it
yeah.
takes us down. It really pounding us, Black people. It really takes us down. If we survive, we have a long journey ahead of us. If we survive, I've had so many people passed away from Brooklyn, Queens, and stuff. They are all Afro American, Haitian. It takes us down.
Mhm.
So, do you think at that time somebody would care that you didn't have a job or that you actually made it? So it is an issue because money will always be an issue. Now the court systems are reopening, so that means you could have eviction. So it is an issue. And like Pastor D was saying, I guess we need to support each other to help. However, your health matters. Your health matters.
Wow.
It's like that balance.
It's hard.
That balance. It's hard. And I don't
I'm
want us
listening. I'm
sitting in the
listening to
panel
this.
and not acknowledging, because we all been fortunate enough to not have to worry about that part. But it does matter. We need to help out. But to me, your health matters, because whoever died is leaving behind a child, a mother, a brother, a sister, and it hurts. It hurts.
Yeah. And Dr. Francois mentioned it earlier too. She says she's part of a community. She knows who's in her community, who's in the neighborhood. So if we take the time to kind of know, I almost sound like Mr. Rogers right now, who's your neighbor, then you might know if your neighbor is not working. You might know if your neighbor is struggling. And if you know, whatever you can do to help, you do that. It doesn't, I think it was last week or the week before, we talked about the role of the church, what the church should be doing. You are the church. You are the church. So if
Exactly.
you know somebody's struggling and you can help, even again, when I
Absolutely.
say help, I don't mean, pay their monthly bills. If you can do that, then you do that. But if all you
Yeah.
can do is pay for that person one bill, guess what? That's what you can do. You do it. If you can cook
Yeah.
for one meal for that family,
Mhm.
if that's the way you can help, then you do that. If it's just buying, when you go to the groceries, buy an extra spaghetti sauce or buy this extra thing because you're thinking about that family, we can all do that. It doesn't require the government to do those things. We can help one another. There's enough of us to make a difference. Now, there is one last question, and I'm gonna have Dr. Francois close it for us. And the question is about, again, family. How do you deal with family coming to your house? And they want to have family dinners. Are we still doing that today? The answer is, as Dr. Francois mentioned earlier, the answer
No,
is
no,
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 no, no, it's not
no.
worth it. It's not worth getting together as a family, exposing one another to a virus that can potentially kill you. It's not worth it.
And
So,
nobody should be asking him to come to your house right now, unless you've been living under a rock that you don't know what's going on.
Yeah.
Nobody should be going to nobody's house right now. That's why there's FaceTime, there's telephone, there's everything. You do that. You do things online. Okay, you should not allow anybody. Right before I came on, my doorbell rang. It was the mail lady who came, and I had to sign something that was being delivered. I said to her, "Put it down here. I'll sign it, and then you can come and get it after I close my door."
Mm-hmm.
Because you see, just that alone, I'm not gonna go out there like that. So no family should be even asking to come over. If you cook for somebody, drop it in front of their door. Tell them that the food is outside. Come and get it. I've done that.
send a
You know,
virtual hug.
Yes.
virtual hug.
Yes.
Yes.
Okay, and I drop it off. She comes to the door. She opens the door. She picks up the food, and I wave to her. She says, "I love you." I said, "I love you too, baby. I'll see you soon." And that's what it is. That is how we live today. That's our new normal, and we must adapt to it, or we die.
Exactly.
Yeah.
It's as simple as that. You have a
Yeah.
choice.
Yeah.
You fight to stay alive, or you die.
Correct.
And
Correct.
I am in the midst of it. I am in the middle of it.
Yeah.
And at least when I go to the hospital, I know where I am. I know that I
Exactly.
am
That's
in
true.
the hub of COVID-19. So I protect myself. So, but when I'm on the street, it's like, oh, it's the street, it's school, it's whatever. I'm not telling people not to go out or whatever. But just know that if you see somebody coming, stay away. You don't have to cross somebody, go hug and whatever. Don't do that. And don't be out there too long. Do what you must do and go back home.
Yeah. Yeah. We want to keep this.
That's sad.
We want to end on a positive note. So there's a question that says, so where is your faith in God when it comes to COVID-19? The answer to that is exactly where it is, in God,
Exactly.
not in COVID-19.
There
The,
you go.
the children of Israel were told to put blood on their doorposts so that when the angels of death pass, it will pass over them. And they had to listen. God gave us ability to think, It gave us ability to process, to know what's going on out there around us. And if you see someone coming at you in a car 65 miles per hour, you don't stand there and say, I have faith in God. God save
Agreed.
me.
Exactly.
You
Agreed.
move out the way. This
Mm-hmm.
virus is not coming at you at 65 miles per hour. It's coming at you at 255
Yep.
miles per hour.
Agreed.
That's not the time for you to
Amen.
say, Jesus,
Amen,
come and
Pastor.
save me. But it's for you to move out the way so that
Agreed.
it will not get you. And the way you move out the way
That's
is
right.
by using the brain that God Himself gave you. Listen to the words of the doctors, listen to the professionals, and stay on your knees. We have to stay on our knees as well. We have to continue to pray. We have to continue to worship. We have to continue to seek God. Listen, God is not looking at this and say, well, since COVID-19 is going on around the world, it's all right. You guys don't need to worry about me. We'll come back later. No, we're still Christian. We are still, the name of the show is The Remedy. We still have a remedy that we still need Jesus. The world state need Jesus. We're worrying about
Exactly.
COVID-19, but there's another virus that's killing, and it's called sin, sin. And so it is our responsibility to continue to teach, to continue to preach, to continue to encourage, and to continue to provide ways for people to be healed. Dr.
Even,
Francois, I want to say,
even more so now, to be honest with you, even more
yeah.
so now because people are more discouraged now. So it is our duty to remain in the word even more so now.
So I want to let you go, Dr. G. I really do, but there is a question here that is absolutely amazing. Because I know teenagers, they see things differently, they feel things differently, they also feel that they are invincible. How do you explain to your teenagers the seriousness of COVID
Even
19?
the early 20s, I don't at
Absolutely,
my house.
absolutely. Absolutely. So I'm going to leave this one in your hands, darling.
Well, when it first, honestly, when COVID-19 first came out, I had to sit with my son, and not just my son, my entire family, because I'm the healthcare provider in the midst of it. They don't see what I see, they don't hear what I hear. So I had to sit down and I had to make them understand. And when I'm talking serious, I put my glasses on. They say, oh, mom got her glasses on. We better listen. So even I have my daughter who's married, who's in Atlanta living her life. She can tell you that I FaceTime her and I tell her how serious this is. Teenagers always think that they are invincible, that it is not gonna happen to me, that I'm young, I'm fit, I'm this, I'm that. And at first though, we thought that it did not teach younger people, it did not reach the younger people. We thought that. And the only thing I can tell people with teenagers is that you have to keep reinforcing. They are children. Even though they may look like, they know, and they think they know everything. That's the thing. They know more than you, who's been living through life. You have to keep repeating. You have to keep reinforcing with them. And you have to bring them down to a level where, okay, so-and-so is sick and dying. You want to see it? Sometimes I literally I have to like bring it up rough to say, this is what happened to so-and-so. Is that where you want to end up? But reinforcement is key with them. They're kids, they're gonna do as kids do. You adapt well, but they don't. They want to be out there running and hang out with their friends and do whatever they do. But remember, you the parent, you the adult, you make the decisions. They're gonna go out. The answer is no, not under my roof. My son was like 2 weeks ago. Oh, so some of my college friends want to hang out to get dinner, whatever. I said, sure, you can go out to dinner. Just don't come back to my house. I don't play that game.
Agreed.
You are not coming back to my house. If you have someone else to go afterwards, you go right ahead. But you're not coming back in here, not up in here in my house. And I tell them that. You have a choice because you can tell them as much as you want. It is up to them to listen to what you're saying. You can't tie them down. You can't tie them down. You know what I'm saying? They have some kind of freedom. But you are the adult. You have to put your foot down in the house. You have to be the bad guy. I don't care if you hate me for now. I'm keeping you alive at all costs.
And not just keeping you alive, I'm keeping the entire family
The
protected.
entire family alive.
That's the key as well. It's not just we don't want you to experience life. We don't want you to do anything. But by you exposing yourself, not only you expose yourself, but you also exposing your entire family, and you need to remember that.
And that's what you have to let them know. You have to
you have
to let them know. Do you care for me like I care for you? Because if you care for me like I care for you, you're gonna try to protect me.
And
do you love me?
Dr. G, I had to say that to my son. I said, you know what? Guess what? You're gonna be out of here, because the truth of the matter is, you know, this thing kills, and I have allergy-induced asthma. So I have a vulnerable population, and I said, you just watch your grandma pass away. So guess what? You can go. You're just not coming back.
Don't come back to my house.
You're just not coming back.
And I'm very straightforward with that.
I have to tell you, my husband went to his mom viewing, and he hasn't been home since, because that was the condition. You go to the viewing, I get it, I appreciate it, and I get it. However, you are going to be with people that took care of her and stuff like that, and you have to quarantine yourself. It's your mother. I get it. You have to do what you need to do for your mother. But my job is to protect me and the family here. Absolutely. And as harsh as it was for me to make that decision, it is the reality, because I have watched in CNN where a family of 8 completely vanished.
Yeah.
Exactly. And I tell my kids that when I have those news, I said, this is what happened. Families just die.
They die.
And how do they die? Because one infect the other.
Just goes. And it just goes.
I said to my son, do you love me like I love you? Because I'm doing everything to protect you. So I expect the same in return.
Correct.
Okay? But you have a choice. You're an adult. You have a choice. You want to be out there and enjoy life. But because I've done all I can for you, you're on your own now. You're not living on your own. But if you go out with your friends, my door is locked.
Agreed.
You're not coming back in.
Agreed.
And that's your choice. And that it's got to be like that with I know Haitian parents. Mom wants the parents you tolerate you talk. Okay? You have got to be that rough with your kids, because their lives and your life depends on it. Don't be showing up. Papa say just because you tell that to the kids that you don't love them. Okay? But you have got to be like that with your children.
Tough love.
You have to give it in this time. And my rules are my rules. I pay the mortgage.
Okay.
My rules are my rules. You can either follow them or you can find somewhere else to go. And that's how I run my house. Not that you don't have a say so, because you live here. You can put in your input. But the final word is from me, and it's final. Nobody else goes above me except God, and you're not God.
We're in tough times, and specifically if you're in the medical field, I'm not in the front line, but I'm still in the medical field. I see a lot of things. Dr. G, you see a lot of things. This thing is real. It is real, and from us being in the Pennsylvania, New York, New Jersey, it is so real. It is so real for us here.
It's brutal. It is brutal. It's
brutal.
I mean, let me just say, Dr. Fosway, earlier at the beginning of the show, you say within the next 6 months, and you use us as an example, 1 out of 3 people will have corona, or you will know someone in your family who contracted the virus. So this is as real as it gets. And so again, I wanna remind each of us that it's not the end, that there is a light at the end of the tunnel. But until we get there, we all have a part to play. We all have to do whatever we can to protect ourselves and to protect those who are around us. So, Dr. Francois, it was a pleasure having you on the Remedy. You're part of the team. I really appreciate all the great what's the word insight that you have provided to us today. There's so much more to learn. Even something as simple as if someone is infected in the house, now what? Maybe one day we can come back and do a show just on that, because I think this is as important as everything else we discussed today.
Right.
Because not everybody has an extra bedroom in the house. So we need to kind of figure out, okay, if someone get infected in this house, what is it that we need to do? So we will definitely, if time permits and your schedule permits, we'd love to have you back on the show again so we can continue educating each other on this very topic. Thank you so much to everyone, to all of my friends on Facebook and on YouTube. You guys are the reason why we have this program. We're supposed to have another show, and because it's 1:30, I want to respect everyone who actually gave us an hour and 30 minutes of their times. We're not going to have the second show right now. We will save it for next week. And so if some of you are disappointed, I'm so sorry for that. But we will be back again next week at 12 o'clock for another show. I love you. Stay
But hold on,
tuned.
I want to take the time out and thank Dr. G. I reached out to you, and you know, you just took us like always. I call her my older sister. I've always thought of her as my sister. I really appreciate you being there for us, and most importantly, though, take care of yourself. I know you're in the front line. I know you're trying to battle this one out, but please take care of yourself.
Yes.
And
Can I pray with you guys? Go ahead.
No,
Go
I
ahead,
said
Dr.
you do the
Shina.
same.
Okay. Just before we go, let's spend a little time. Let's thank God for today's program. Father God, we just want to take a moment again to say thank you for giving us some minds and putting people around us to kind of help us to understand the time that we are living and what we can do to protect ourselves and our families. Father God, we pray for those who are in the front line, those who are exposing themselves at a greater risk on a daily basis so that they can heal those who are affected with this virus. Lord, we are, at the end of the day, we are all in your hands. So we just ask that your will be done in our lives. Help us to be a source of blessing to those at this particular time who are struggling to pay the bills, to have a meal on the table. Lord, use us as you see fit. May we reach out to our community. May we reach out to our families and friends in ways that so that we can help them. We love you. We thank you, and we appreciate you for all that you are doing for us. In Jesus' holy name, we pray. Amen.
Amen.
Amen.